Hi everyone, welcome back. So today's topic for discussion is Sever's disease, otherwise known as calcaneal apophysitis. And this is going to be relevant to you teenagers out there. So basically, if you have a child who is getting a lot of heel pain, this could be for you. So basically, repetitive trauma and inflammation of the growth plates of the heel bone due to traction of the Achilles tendon can cause heel pain in those between 8 years old and 14, and this is known as Sever's disease. Now, it affects children of this age because the calcaneal apophysis, or the growth plate, which is mostly cartilage, develops at around 7 or 8 years old. And it doesn't complete ossification until around 16 years old. So that's why this problem affects children in that age group. Also, this is the time when participation in sport and therefore the force through the joints increases, but the heel bone is still weaker than in adults because it's mainly, you've got this big sort of area of cartilage, so it's more prone to injury. Now, Sever's disease can occur in just one heel, but usually around 60% of cases will actually involve both feet. So if we look at this diagram here of the foot, we can see the calcaneus, which is that heel bone, and you can see the calcaneal apophysis, which is the growth plate there, which is mainly cartilage, as we said, in children between 8 and about 14 to 16 years old, at which point that cartilage becomes ossified and much harder and stronger. So with Sever's, obviously the Achilles tendon, it attaches onto that heel bone, that calcaneus, and with increased sport, with increased force through that that joint, you can then get inflammation and pain. So, as we've just seen, the Achilles tendon inserts at the back of the heel bone, and the calcaneal growth plates that we saw are placed under stress from both the Achilles tendon and also from the plantar aponeurosis, or the fascia that runs along the sole of the foot on the other side of the growth plate. So you've got them kind of pulling in opposite directions. So who is at risk of Sever's disease? Well, as we've said, certainly it occurs in children between the ages of 8 to about 14. It's more common in boys, usually aged 10 to 15, because they have later growth spurts. It usually occurs in girls between sort of 8 to 13, but it never occurs after puberty when those growth plates have ossified. It can also occur in those that are overweight, or alternatively in those who are very active, particularly if they're doing a lot of running and jumping on hard surfaces, maybe football, basketball, gymnastics. If you're participating in a lot of sports and you're wearing, unsupportive shoes as well, this is going to increase the chances of these symptoms occurring. But also biomechanical abnormalities, so things such as flat feet, foot varus, high arches, or even bunions, which, to be honest, that's quite unusual in a teenager, but they can all sort of affect the way a force will impact on a joint, and therefore affects the likelihood of that inflammation occurring. So the causes of severs are basically a growth discrepancy where the calf bone grows at a faster rate than the calf muscle and the Achilles tendon, and so this will then cause those soft tissues to tighten, which in turn will place additional strain on that heel bone, because the Achilles tendon and the muscles are kind of being stretched to catch up with the bone, and it's going to pull on that heel bone. Also an altered foot position, so if you've got one of those biomechanical abnormalities such as flat feet, for example, this can cause excess pronation where the sort of foot turns inwards, which causes uneven weight distribution on the heel bone. Or another cause is high level of activity, and as we've said, particularly sports that involve running or jumping on hard surfaces, such as gymnastics or basketball, and this again can just increase the stress on tissues that may already be tight due to that growth discrepancy that we've just talked about. So in this diagram we can see either side of that heel bone, we can see the Achilles tendon, and we can see also the plantar aponeurosis running along the bottom of the foot there. So you can see how if the tibia and fibula bones in the calf have a sudden growth spurt, if that Achilles tendon is trying to kind of catch up and sort of stretch to try to catch up with that bone growth, it's going to pull, on the heel bone here and cause inflammation in that growth plate. And obviously, if there's any issues with plantar fasciitis, for example, this one is going to be pulling that way. So you're going to be getting pulled from both sides of that growth plate there, which is going to cause a lot of inflammation and pain. Now, there are other conditions that may cause posterior heel pain, things such as Achilles tendinopathy, Haglund's deformity, or retrocalcaneal bursitis. Also, if there is a calcaneal stress fracture, so stress fracture in the heel bone, bone spurs on the heel, or heel pad syndrome, all of these can also cause posterior pain. But obviously, if it's happening, within that age range that we gave earlier, there's a very good chance that it's going to be severs. So there are a couple of tests that you can do to kind of try and confirm a diagnosis of severs. So there's the passive dorsiflexion test of the ankle, which will demonstrate limited dorsiflexion, which is where, so if this is the foot, so these are the toes, so it's where, so if you sort of pull those up, put the toes up, they're not going to they're not going to kind of sort of flex back, or the bringing the whole foot up, it's not gonna, you're not going to be able to bring it up as far as sort of that normal range would be, because everything around that heel bone is going to be so tight and painful. So there would be limited dorsiflexion, and there would be pain, if someone tried to dorsiflex the foot. Also medial lateral compression of the calcaneal growth plate. So if you are applying pressure either side, if that brings about a positive pain response, you can pretty much guarantee that it severs. Also, if there is any gait analysis done, that may indicate either a limp or a forceful heel strike as well. So, what are the symptoms of severs? Well, certainly pain, pain and inflammation in either one or both of the heels, and also in the lower leg, because you're probably getting pulling on that Achilles tendon. Pain will usually be better when the child gets up in the morning or if they've rested, but there will be increased pain with weight bearing, running, jumping. Tenderness will be felt on medial and lateral heel compression, and there may be a tender swelling or bulge on the heel that is sore to touch. There could well be calf stiffness in the morning, first thing. The pain will also be worse when wearing sort of harder, stiff shoes like football boots, because again you're going to get that compression on the heel bone. There may be walking or running either with a limp or on tiptoes to kind of take the pressure off that heel. There may be other biomechanical abnormalities that we've spoken to, such as particularly high arches or flat feet, which are going to affect the posture and therefore the force going through that heel. And there may also be restricted ankle dorsiflexion due to that Achilles tendon being tight. So, how can this be treated? Well, Sever's disease will disappear on its own following the growth spurt and following puberty, and it won't cause any long-term problems. The best way to manage it really is through rest and reducing sports activity, which unfortunately for some sports lovers, that's probably going to be the worst thing in the world. But yeah, rest or reduction of sports. Certainly you can use ice to reduce the swelling and pain. Non-steroidal anti-inflammatories such as ibuprofen or naproxen, possibly ketoprofen gel to relieve the pain. Stretching to work on lengthening any tight calf muscles and the Achilles tendon, just to try and reduce the amount of strain on that heel bone. And also stretching on the plantar fascia on the other side, on the sole of the foot, to help improve, take the pressure off the heel bone and improve that dorsiflexion, and also to strengthen the extensor muscles. Also, gentle mobilisation of the subtalar joint in the ankle and the forefoot area may help. But, if you are still, participating in sports, just, pace yourself while, the injury is healing. And potentially, even strapping the ankle during sports, just to reduce the range of motion may help. Ankle foot orthosis to prevent overpronation of the foot, particularly if you've got something like flat feet. That can prevent overpronation and also improve the shock absorption capability of the foot. Supportive shoes are a must anyway for anyone participating in sports, and a heel raise potentially to reduce stress on that Achilles tendon, to reduce that pull, particularly as well if flat feet or high arches are an issue. Then certainly having some sort of orthotic aid can really help. Physiotherapy can be used to reduce pain and swelling, relieve muscle tension, and also reduce the stress again on that Achilles tendon and calf muscle. And of course, massage therapy, can do the same. In severe cases, casting may be used to rest the heel. Corticosteroid injections, however, are not recommended for Sever's disease. So, the best way to sort of assess, so for you massage therapists out there, or or even for you as parents, if you think that this may be an issue, you can look at the person performing a squat. Often this will show overpronation and external rotation of the foot, sometimes with a shift in body weight to one side. So this can also result in a pelvic tilt and possibly hip problems as well. If casting has been done to rest the heel at any point, then this mobilization may have caused muscle weakness or compensatory measures in the fascia. So again, this can be addressed with massage really well, or with physio. Tight hamstrings or previous hamstring strain may also present as difficulty in touching the toes. Yeah, just be aware of that. If the client is having problems touching the toes, it may not, it's more likely to be due to hamstring issues than calf issues. But potentially, when people have compensatory mechanisms, when the issue's already there, it may be that they then go on to get tight hamstrings as a result. A single leg lunge may show loss of core stabilization, and potentially the knee on the back leg may cave in. Usually you can see symptoms happen as sort of like this chain of events. It will start with reduced mobility in the foot and the ankle, which can then lead to hamstring compensation, lack of core control, because of course our hamstrings are so important for our posture in general, and stabilization of the lower back. And often these factors can then cause hip pain or problems with the TFL, the tensor fasciae latae, which is up by those gluteal muscles. So in terms of massage, what can massage do for someone with Sever's disease? Well, it will help obviously increase oxygenation and nutrition to the tissues, because of the effect it has on the blood and lymphatic circulation. So, particularly working around that calf area and the Achilles tendon. So it can increase oxygenation and nutrition, and also remove waste, and therefore help with the healing process and recovery. It can also release tension in those calf muscles and the Achilles tendon, which will then ease the pressure on that heel bone, will reduce that pull, and also to ease tension in any compensating muscles such as the hamstrings, the glutes, the TFL, and can also work on that plantar fascia in the foot as well. Gentle stretching can be introduced once the tension has been released, being careful not to overstretch the calf, because this will actually then increase heel tension. So it's quite a fine balancing act. In terms of prevention, Sever's disease will only be an issue while the growth spurts are still happening, but you know, the following measures can help reduce symptoms. So stretching the calves and hamstrings, but as we've said, don't overstretch the calf because that can then increase the tension on the heel. Avoid lots of running and jumping on hard surfaces, and avoid overtraining. Just ensure that you take sufficient rest periods, and of course, you know, wearing protective, you know, really supportive shoes that are going to protect that heel and the ankle joint, and you know, again, use of those orthotic aids as well, just to sort of counterbalance those biomechanical abnormalities. They, you know, they should help. And you know, the final thing, you know, if you are overweight, you know, it is an idea to try to lose weight, which I appreciate may be difficult, you know, if you are having to reduce your activity level, but you know, it will help to just again reduce that strain on the heel, and hopefully therefore, you know, improve pain levels. So that really is Sever's disease. Do feel free, if you found this useful, feel free to comment down below or subscribe to my channel. There are various other videos on injuries during growth spurts in teens and all sorts of other things, so do take a look on there. And you can also contact me if you have any questions. Do contact me on Facebook or Instagram. I'm on there as the Medical Massage Lady. I will also very soon have my website up and running, which is www.themedicalmassagelady.co.uk. Or for you massage therapists out there who would like to do some CPD training in injuries like this, you can go to www.medicalmassagelady.com and take a look at my courses there. They have much more of a medical focus. But that's all from me for now, so there'll be more coming up. Keep a lookout. But for now, take care, and I'll see you next time.